Health officials in Larimer County have confirmed that a sample of the mosquito population in the county has tested positive for West Nile virus. The infected mosquitoes were found in the southeastern part of Fort Collins. So our health expert, Dr. Pyle Coley, is here with us now, thank goodness, because I know a lot of people are thinking about this. How do mosquitoes even get West Nile? How do they spread it? Should we be worried?
Yeah, so West Nile virus is a mosquito-borne illness, which means the mosquitoes are the vectors. So the mosquitoes feed on infected birds. They carry the virus, don't get sick from it themselves, and then bite a human and spread it. Now, the good news is you can't spread it really human to human. So coughing, sneezing, touching, it's not a respiratory virus, so to speak. If you got a blood transfusion, mom to baby, or you got an organ transplantation, you were infected, then you could potentially spread it. But it doesn't spread between humans. It's really those mosquitoes that are the troublemakers.
And I mean, you got a bite coming in today.
I did, isn't that ironic?
Often, they say mosquitoes, most active at just, just as it's starting to get dark. I get bit during the day all the time too. So when you get a bite, when do you panic? What do you notice? What are the symptoms we need to pay attention to?
It's interesting, mosquitoes tend to bite identical twins more. So there's something genetic or your pheromones or something that tends to attract mosquitoes. So I get a lot of bites as well. So you really need to panic. If you've had a mosquito bite in 2 days to 14 days, so up to 2 weeks later, you start to have symptoms. And so most people that get infected with West Nile virus will have no symptoms at all. 80% of them won't even know that they got bit. They'll just kind of clear the virus. But 20% of them will have symptoms that resemble COVID. So you want to keep your eyes up because the COVID is circulating as well. You'll have fever, you'll have joint aches, you might have a rash, you might have diarrhea, so you might think you just got an infection or a cold. But if you've been bitten by a mosquito within the 2 weeks before, then it might make sense for you to talk to your doctor about testing. Now, 1 out of 150 people who get infected will get really sick. They'll get meningitis, encephalitis, where it's gotten into the brain and the central nervous system. You can have seizures and coma, and that's life-threatening.
What is the percentage of that?
1 out of 150.
1 out of 150.
So if 150 Coloradans got bitten by mosquitoes, one of them would have a severe complication. And these generally tend to be the people you'd expect over the age of 55, patients with cancer, HIV, immunosuppressants. But it honestly can really happen to anyone if the virus divides enough and gets into your central nervous system.
And if you're one of those 150 and you start to notice the symptoms, if you go and get it diagnosed, is there any treatment that could mitigate all that or no?
There's no treatment, which is why prevention is really important. So whether you're having mild symptoms or more severe, it is important to get a diagnosis because, the supportive care sort of is guided by that. And the way we would do a diagnosis is do the blood test looking for antibodies, but also potentially a spinal tap. If you have those symptoms in your brain or nervous system, then you're looking to see if the infection is there. And it's mostly supportive care. Now, the good news is most people, even those 20% that get, like a flu-like illness, will recover without any long-term sequela. So it's rare to have those complications, but I remember in medical school, the first time I ever saw a West Nile case was somebody who came in a coma, couldn't breathe, couldn't talk. They were in a coma for 3 weeks because it got into the brain and it caused the brain to swell.
Yeah, some people live with lifelong effects of having West Nile. So I know sometimes we report on locations at areas where they have an abundance of mosquitoes and they think there's more with West Nile. But when you say you got a bite coming in here today, to be fair, most of us do not put that repellent on in the middle of the day. It stinks. It's ugh. Is that what we should be doing?
Well, so you could do the repellent, especially at dawn and dusk. I would definitely recommend it if you're going to be outside walking or walking the dog or anything like that. Sam, get rid of your bird bath because standing water, especially now that the mosquitoes are here with it, because standing water. So, you want to drain, dress, and defend. So drain means drain any standing water, and dress means dressing yourself. So I would cover up with long sleeves or something, wear a little jacket if you're not somebody who wants to wear that repellent, but also make sure that your house is dressed, which means the screens don't have any holes because that can let those mosquitoes in. And then those repellents are probably the most effective way to get rid of the mosquitoes. Now, we can't not go outside. It's summertime. It's okay. We don't have to panic about this, but just know about it.
I know we're out of time, but what do you do to stop the itch?
Oh yeah, I put an X in mine and you told me I can't do that.
if you get a mosquito bite. So you can put a little calamine lotion, you can put aloe vera gel.
But don't poke it
or
like I do.
Do not poke it. You can put hydrocortisone 1% over the counter from Target or Walmart, helps to stop the itch. But if you keep itching it or poking it, like Sam was just doing, you're going to get probably scarring and pigmentation from it. So.
I know, I had to say it, just had to ask. Okay, thank you, Dr. Coley. Don't forget, you can find more stories with Dr. Coley at 9news.com/Dr. Coley.